Dr. Hajal, when it comes to sleeping well, does position matter, for example, sleeping on your stomach?
No, it doesn't. I can't say that it does. Everybody should find the comfortable position that they have and be able to fall asleep. But they should know that this is just behavioral. This may change. It doesn't mean that somebody is born to sleep on their side all the time and so on. That can change with the bed that you're sleeping in, with your bed partner, and with the comfort of the mattress and so on. So we have a lot of people who say, I never, ever sleep on my back. But then when we're studying them, we find that they actually spend almost 20% of the night sleeping on their back, which is frequent. And whenever somebody tells me I never go into that position, I expect them to at least have 10-20%, which means the majority of the time they aren't in that position. But still, people have to toss and turn at night. You cannot be sleeping on one part of your body through the night, because it's not good for the circulation of that part. It's not good for the nerves. You know, some people who lose consciousness, for instance, and sleep on one side on their arm, they may wake up with a paralyzed arm. So it's not normal for people not to move a lot. It's okay to toss and turn. But the more comfortable the bed is, the less you toss and turn. Yes, by all means, I think it's true. Now, if you want to talk about positions, snoring, for instance, typically does get worse when you're laying on your back, and does get better when you're laying on your side. Most of the time, this happens. And frequently we see people who, you know, they used to be nudged to go on their side to get the snoring better, but now they're coming because even that's not working anymore. And that's one position. Another one is in the elderly. We find there's a lot of difficulty with the position of sleep. So we find that a lot of the older people are sleeping in a recliner because they find that to be better. And that has to do with stomach problems like heartburn. It has to do with breathing problems and cardiac problems. And those would get better with positional changes during sleep, and your sleep will be a lot more restful. But of course, you know, it would be better to treat the underlying disease and go back into bed rather than stay in a recliner all the time.
So if they're sleeping in a recliner, they're not getting the different positions.
That's true, and this is the difficulty with the recliners. They won't be able to turn through the night. It's not a healthier sleep than staying in bed. Sometimes their condition is not so much treatable, and they end up sitting in a recliner.
Well, they must get very sleep deprived too.
That's true, and it's known that the more medical issues you have, the worse your sleep is going to be, and of course the main treatment would be to treat the underlying condition as opposed to just giving them more sleeping pills and so on.
Thank you very much.
Thank you.